The FDA has given an emergency use authorization for 12 to 15-year-olds to begin receiving the Pfizer coronavirus vaccine.
The latest news is welcome for U.S. families struggling to decide what activities are safe to resume when the youngest family members remain unvaccinated.
That's a good place to start our discussion on our weekly visit with UW Health's Chief Quality Officer, Dr. Jeff Potoff. Jeff Potoff, good to see you again, Doctor.
Good to see you, Mark.
How significant is this 12 to 15 age group opening up?
You know, I think it's a big deal for a lot of reasons. You know, one, it increases the number of people we can vaccinate to get to that, all-important herd immunity. But perhaps even more important is, our kids have suffered through this pandemic. Getting them vaccinated so that they can go to school safely, they can participate in extracurricular activities like sports safely, is good for the kids, but also gives their parents significant peace of mind. So this is good news that we're hearing coming out of the FDA.
Dr. Potoff, there are some parents who are saying, you know what, I'm just going to wait a little bit until maybe somebody else gets it first and see how their kids are doing. What do you say to people who are, maybe a little bit on the fence at this point?
Yeah, I can understand that hesitancy, but when I weigh it, thinking of my kids and this Pfizer vaccine, it really has been extraordinary how effective it's been. The safety profile is really like nothing we've ever seen. And unfortunately, I have seen kids who've gotten COVID. I've seen kids who have had this long haul syndrome afterwards. And, the worst are these kids who get this multi-inflammatory syndrome secondary to COVID. I've flown those on med flight. And when I see that, balance that on the scale, I'd sign my kids up as soon as I can to get vaccinated so I don't have to take the risk of them getting one of those other things.
How about the next group, the 2 to 11s?
Yeah, we don't know for sure, but I'd say, the studies are on track. I wouldn't be surprised if we see 2 to 11 eligible for a vaccine, maybe September, right around school going back. I think that would be good timing to make the next school year seem much more like normal than the last school year.
Do you think that this is going to be something that schools might make mandatory?
Yeah, I think it's a good question. I think, the general trend has been when it's under emergency use authorization, it gets a little bit hard to say it's absolutely mandatory. But I think as you see full FDA approval, you might start to see the COVID-19 vaccine required, just like other vaccines are required for school, with limited exceptions. So something to look forward to in the future as this unfolds.
Now, people that have been fully vaccinated, what's the thinking now with masks on that?
Yeah, for people who are fully vaccinated, we know that they are, less likely to carry the disease in significant quantities, although we don't know for certain that they can't transmit it. But if you get a group of people together who are all vaccinated, that's pretty safe. You can probably take that mask off. The real risk then is for those who are unvaccinated or those who tried to get vaccinated, didn't mount an immune response, or those who are still ineligible for vaccines like our kids. They still have some risk if they're mingling with folks who are unmasked.
But we're getting there.
We're getting there. It's happening.
It's hard to believe, but we might be somewhat normal sometime soon.
Let's hope.
Yeah.
Doctor, thanks for being with us. We'll see you next week.
Anytime, guys.